So this page of the workbook is the first difference between asteroid hyalosis and synchysis interlens. No pictures can be asked in this. That is for 100% sure. Now asteroid hyalosis is, what do you want to know some differences? See, it is a unilateral condition mostly seen in elderly in which the vitreous is normal and some calcium is deposited in the vitreous and mostly related to diabetes mellitus, but no problems in the vision. Is asymptomatic condition. Treatment is not required because it is asymptomatic. There are some calcium deposits, but no symptoms. Well, synchisis, the word means the vitreous is liquefied. Mostly in youngs and bilateral condition with underlying some ocular conditions, trauma or ocular conditions, and there are some cholesterol crystals. Here, calcium deposit. Here, cholesterol crystals are there. Here, the visions can be reduced depending on the underlying condition. And treatment is not of synchisis, but treatment of the underlying condition can be there. That is the difference of synchisis and asteroid hyalosis. Nothing else can be asked apart from this. Now, one thing is very interesting, how to see gonioscopy. I told you in the workbook as well. It's a very important question. The staging of gonioscopy is not asked. The grading is not asked. Schaffer grading another is not asked. But this, how to know clinically whether the antechamber is normal or deep or shallow. You can throw a torchlight from the periphery, and if the angle is open, means deep antechamber, the iris will not come in the path of the light. But if iris is coming into the path of the light, you see over here, the light is shown from here and iris is coming in the path. So iris shadow is seen on the other side. This is not the iris shadow test of cataract. Now this iris shadow test means the shadow of the iris is seen on the other side. It means the antechamber is shallow. So it is a clinical objective method, not quantifying. It is a clinical method to know whether the antechamber is shallow or not. That is known as a pen torch method. Here also there is the iris shadow. If there is the iris shadow, means that the antechamber is shallow. The angle might be occluded or closed. And there is another clinical method to know on slit lamp, Van Harris method, to compare. See this, a very high magnification. This is the slit at the level of cornea. This is at the level of iris, and this is anterior chamber. So you measure the thickness of the cornea with the anterior chamber depth on the periphery of the slit lamp. That is Van Harris method. It compares the thickness with the anterior chamber depth. Now, if the thickness is more than, if the anterior chamber depth is more than one of the thickness of the cornea, it means the anterior chamber is deep and the angle is open. Now, this cannot be asked like this grading, but Van Herrick's method is for determination of the anterior chamber depth. That question can be, one liner can be asked. 1/4 to half of thickness, that is third grade. 1/4 of the corneal thickness anterior chamber depth is second. Less than 1/4 is first one. Extremely narrow anterior chamber, extreme narrow angles. And when there is a closed anterior chamber, you will not be able to see the anterior chamber depth. So the comparison of the corneal thickness with the anterior chamber depth, that is Van Herrick's method.